Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by the Chief of the Cardiovascular Department from RUMC, Dr. Francesco Rotatori, my actual first repeat guest here for Season 2 today. Thank you for joining me.
Thank you, Meredith, and I'm very happy to be here again.
Yes, our first guest. So through RUMC Connections, you will meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll provide useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. So we are going to discuss cardiology myths. We are going to debunk some myths today.
Very good.
And a lot of common things that people come across are cardiovascular disease is a man's disease. People think I'm too young. Oh, it's breast cancer. That's the real threat. So, if you've heard or said any of this before, I want you to know that you're not alone. The real fact is that relying on these fake assumptions can cost you your life. So it's time to set the record straight and start thinking of heart disease as a disease that doesn't spare women and children. Your health is non-negotiable. We need to separate fact from fiction so that together we can stop this killer once and for all. Now, February is American Heart Health Month, and according to the Centers for Disease Control and Prevention, heart disease is the leading cause of death for men and women in the United States, with one person dying every 34 seconds from cardiovascular disease. It's a pretty staggering number. So, as I mentioned, we are joined by Dr. Rotatori to debunk some of these myths. Dr. Rotatori graduated medical school at the University of Milan in Italy, and he followed up his education with postgraduate training at the Centro Cardiologico Manzino, a prestigious medical center in Milan that specializes in cardiovascular disease. He later attended the State University of New York Downstate Medical College of Medicine for his cardiology and interventional cardiology fellowship. Since completing his training, Dr. Rotatori has earned board certification in internal medicine, cardiovascular disease, interventional cardiology, echocardiology, and nuclear cardiology.
So basically what my wife says is like, after all this training, I should know something about this.
Just a little bit, right? And Dr. Rotatori is our Chief of Cardiovascular Department at RUMC, and he provides prevention and invasive treatment to thousands of patients from across the New York, New Jersey metropolitan area. So you can rely on him to debunk all of my myths today.
Let's give it a try. Okay.
So, in this digital era with so much information at everyone's fingertips, we know many people are quick to hop on Google to Google diagnose themselves or visit sites like WebMD. And we are going to raise awareness today and clarify some things about cardiovascular health. One of the most common myths is that heart disease is for men and cancer is the real threat for women. Are women as at risk for men as heart disease?
Yeah, well, yes. So let's debunk the first myth. And again, this time I'm going to apologize for my accent, but that's the best I could do. And one more thing I want to say is about the things that you said at the beginning. It's interesting. Nowadays, every time I see my patient, I know that I'm always the second opinion, meaning they have already an opinion when they come to the office. They know already the diagnosis. And that's the world we live in. It's not that we're not complaining about that. But we know that that is very difficult to understand the reality of medicine, because it's a very complex. Our body is a very complex series of organs, and it's not easy to get a good idea just looking online. I always give this example that when I have to cook on a grill and I look online how to cook certain things, you can find 10 different ways to do that. And the same thing is that when you look for your health problems, I mean, you're going to find 10 different things that are going to tell you exactly the opposite. And it's difficult to pick the one that is really correct for your specific diagnosis. Now, talking about women and health, yes, I mean, women can get heart disease as well as men. The number one cause of death for men and women is heart disease nowadays. It is true that it's very important for women to to be concerned about breast cancer, and definitely I'm not underplaying the other problems, but this is a big problem. And I think the myth comes from the fact that there is a knowledge that the hormones that are part of women's life, and so the estrogens, and they actually have a protective effect on the heart. And so for this reason, it is true that if we look at the statistics, we will find out that women, generally speaking, they get affected with heart disease a little later in life compared to men. So the average age. So that's the only difference. But other than that, unfortunately, they are exposed to the same type of issues.
Gotcha. Moving on to myth number 2, speaking of age, how about the myth, I'm too young to worry about heart disease? Can heart disease affect people of all ages? And how do things like birth control, sedentary lifestyles, smoking, how does all of that impact people's health?
Yes, I mean, the short answer is yes, people can be affected in all ages. A little bit difficult here to explain. We have to give a couple of information. First and foremost, there's different type of heart disease. All right. So, but commonly when we talk to people, we're thinking about the heart disease that is the clogged arteries that can give a heart attack and all this, and everything that has to do with that, meaning like developing of weak heart muscle that can cause what we call heart failure and all this. That type of disease is a disease in which basically what happens is that you build up cholesterol in your plaque, in your arteries, and that buildup of cholesterol at one point is going to narrow the artery or even close it down completely. There's no blood flow coming through the heart muscle, and then the heart muscle suffers what we call myocardial infarction, which means basically that the muscle dies and gets replaced by scar tissue, and that makes, of course, the whole pump more dysfunctional. Now, that type of disease happens throughout our lifetime. The buildup of cholesterol happens through lifetime. And a number of factors can influence if that type of disease is going to happen earlier or later in life. Unfortunately, there is a big genetic component. So there are some people that are way more predisposed than others to have this buildup. And if your genetics, let's say, they're really on the more severe side, the worst side, really heart disease can develop very young in your 20s, this type of heart disease in your 20s, in your 30s. On top of that, there is your lifestyle. Yeah. What it means is that you're predisposed, and then there are some other factors that they promote the deposition of cholesterol. First of all, the amount of cholesterol that you have in your bloodstream. And so if you think about your diet, if your diet is based on the food that has heavy content in cholesterols, and that is going to increase the level of cholesterol circulating, and for this reason also is going to increase the chance that this cholesterol is going to eventually build up in your arteries. Also, smoking. Smoking creates these free radicals. There are these particles that they go around, and for some reason they bind to cholesterol, and that makes it much easier for the cholesterol to deposit in the arteries. And there's so many other factors, including sedentary lifestyle, including diabetes, which is a very, very big factor too, because the high sugar content in the bloodstream, it's somehow poisonous for the arteries and makes it again easier for this process of deposition of cholesterol. That is almost an inflammatory process of the vessel. An inflammation of the vessel wall makes it much easier to develop. And so all these factors can make your heart disease develop earlier in life rather than later. Do we see a lot of younger people with disease? Yes, we do. Okay. That's one part of the answer. The other part of the answer is that there are other diseases of the heart that can develop early in life. Rare congenital anomalies, but also the use of certain drugs, recreational drugs that it's kind of widespread, can cause acute event, even in the presence of a very healthy heart otherwise. So all this to say is that it's never too early to be concerned about the heart, especially if your lifestyle is not the best. So that raises the idea that certain concerns about some pains that someone has, and then we can dig into that. But they should not be excluded just because I'm young. That's what I'm trying to say.
Okay, that makes sense. Now, asking for a friend here, myth or fact, a glass of red wine is good for your heart.
So yes, a glass of red wine. This is a good myth. It's true. It's good for yourself. Now, of course, we have to discuss about how do you consider a glass of wine. There are jars of wine, glass of wine, and that's not what we're talking about. A glass of wine, it's healthy because it reduces the inflammation of the arteries and has some other good effect. Too much wine, though, it's not good.
Okay, well, you heard it from our chief of cardiology. You can
Yes.
have your glass of wine. Okay, that's great. So another common myth is that heart disease doesn't affect women who are fit. Is that true? And if not, what factors impact your heart health?
Okay, this goes back a little bit. I mean, it can affect women that are fit. It can. There's no question about that. Being regularly active definitely it's a good prevention for heart disease. The American Heart Association website will tell you that if you are regularly active in your life, you have 30% less chance of having a heart attack in your lifetime, and 50% less chance of having a stroke in your lifetime compared to a person that is not regularly active. That is already a fact to say that being active, being fit, is definitely a good thing. But unfortunately, as I was saying before, going back to what I was saying before, genetics plays a role, and some people are destined to have problems despite of their life, their best effort in their lifestyle. Again, this is here to say, try to do your best, but always have a concern if something happens that it doesn't sound right, and you're just saying, "Well, I'm fit, nothing's gonna happen to me." That's unfortunately not correct.
So it's still important to get screened and
Yes.
check, of course. Okay. Another scary myth is I don't have symptoms. Is there a high percentage of deaths from coronary heart disease in cases of people with no symptoms? And if there are symptoms, what are some that men and women should look out for?
That is another thing that we need to clarify. I mean, is it possible to have no symptoms and then develop a problem? The answer is yes. Well, the reason is that, let's talk for a second about symptoms, meaning what are the symptoms that we're looking for. And again, here I'm talking specifically about this, one of the major problems, which is the problem of having, we say, the clogged arteries, the buildup of cholesterol in your arteries. Symptoms like chest pain develop when the artery that is providing blood supply to some portion of the heart narrows down, there's not enough blood flow, and so the heart muscle, like any other muscle, when it doesn't receive enough nutrients, gives signs back to our brain to say, hey, I'm struggling here, which is in the form of pain. Yeah. And the pain is what we call visceral pain. What it means is that it's not a pain that it's easily localized, meaning people usually don't have heart disease and they can finger point it and say, this is where I have the pain. Yeah. But they will say, they will use their open hands. They will say, I have pain on my chest. I have pressure on my chest. Mostly on the left side and the center of the chest, but sometimes also on the right side for some reason. That type of pain is the most common pain. And if you think about physiologically, you would say, well, so every time you have a clogged artery, you will have that pain. And for the vast majority of time, that's true. But the reality is that, unfortunately, and especially in the presence of diabetes, but also because we're different, some people might have a very high tolerance to pain. Yeah. Some people might consider that pain coming from somewhere else. And some people, maybe because of as a protection system, they try to downplay the symptoms that they're having. And so they might have symptoms, but they might not realize that they're having symptoms. And because the symptoms are not the one that they would expect to have. So, for instance, oftentimes they are mistaken for stomach pain or reflux, and say, it has to do with my digestive system. Okay. It doesn't work well or so. I would always advise people to be very concerned if the pain that they're experiencing, whatever kind of pain they're experiencing on the chest, develops on exertion. That's a very, very big warning sign. And the reason it's easy to understand. If you have a problem of blood supply when your heart is required to work harder, that's when the problem is more present. So if you see that consistently, every time you do that certain exercise, the pain comes, that's when really it's a little bit of a warning sign. If the question is, do you always have symptoms? In this case, I would say you mostly have symptoms, but some people, unfortunately, would not experience it or would not understand the symptoms. Then the other things that I need to explain is also that the process of having a heart attack, which means that the artery closes suddenly, happens when one of these plaque that is building up can rupture and close immediately. That closure, that blood clot that forms in the artery is a sudden event. And so potentially you might have a plaque that is not causing any limitation of flow, and so it doesn't give any symptoms, and then suddenly becomes something much more prominent and gives the pain. So can you have a heart attack without not having any symptoms the day before? The answer, unfortunately, is yes. Now, I don't want to scare anyone. The rate of these things happening is very rare.
Yeah.
But I'm just, most of the time, you have the pain, things develop in a certain way, and you have time to get to the doctors or so. But unfortunately, you hear people out there and say, oh, my friend, he was perfectly fine, and this happened. It happens. And that's the reason why we have, and the good news here is that we have developed a series of screening tests and a series of, we really now are learning more of a path for our patient to understand their cardiovascular health before something happens.
That makes sense. Okay. Now, jumping back to people who might be genetically predisposed to heart disease, that's another myth. Oh, heart disease runs in my family, so there's nothing I can do about it. While that could be partially true, that because they're predisposed to it, what are some things that they can do to protect their cardiovascular health if they're predisposed genetically?
Yes, that's a very good question, and I have to debunk this myth probably in many different ways. But I have to start saying that, yes, as I said before, genetics plays a big role. The one thing is that research has been able to know better and better where this genetic lies, and so what are the factors that are genetically predisposing people. And so there is a good expectation that in the next years or so there are going to be medication that are going to come out and trying to target particular genetic predisposition. For instance, a lot of this has to do with the way this cholesterol is carried around in the bloodstream, and it usually doesn't go around on its own, but it goes around bound to some proteins, and this protein can make it easier or harder for the vessel to deposit in the wall, for the cholesterol to deposit in the vessel wall, and that's genetically determined. But maybe we can target with some sort of treatment this specific protein and make it less likely to build up cholesterol in the artery. So again, can we do something for the genetics? More to come. Hopefully we can even modify the genetics. Yeah. And this is a big field that for the next 20, 30 years of medicine is going to go. But the other thing that we need to understand is that disease of the arteries has a genetic component and then has a lifestyle. So to anyone that has a strong family history or so, my suggestion is try to do your best to limit the other factors. So to reduce as much as possible the risk of having disease. And also, I mean, I'm not here to say that everybody has to be perfect, and I'm the first one to say that it's not easy. But the other thing that I'm going to say is that if you know that you have family history or so, find a good doctor that can help you do what we call early detection. So looking for those signs or even for those tests that can help you detect if you really have what we call the bad genes, meaning if you really have a process that has started and is going fast of building up the cholesterol in the arteries, and so you can act upon earlier rather than later. For instance, this is a simple example. We know that we have medication to lower your cholesterol level, and there are certain targets that you want to reach of your cholesterol levels. Well, if we know that you're building up cholesterol, your bad genetics, there are clear data showing that you might want to be even extra aggressive, let's say, in treating your cholesterol level, extra aggressive in treating your blood pressure. And so these things that certain things that we can definitely do.
I was reading an article recently. It was a Harvard Medical School one. It was something about testing that's being done for infants of people who are genetically predisposed to cardiovascular disease. Have you heard about this?
Yes, I mean, there is a lot of research, again, in early detection or so. Studies have shown that the buildup of cholesterol basically starts on day one.
Wow.
And so there are what we call streak of cholesterol, even in arteries of infants. And so it is important probably to develop an early detection program for especially in those families where the risk is really, really high. So don't get me wrong, I'm not saying that now we have to start sending little kids to cardiologists to know if they're going to have a heart attack. That's not what I'm saying, but there is a growing evidence that especially for the limited population that is a very, very high risk, early treatment can probably be beneficial.
Let's talk a little bit more about high blood pressure. Another myth is I'd know if I had high blood pressure because there would be warning signs. So why is high blood pressure often referred to as the silent killer?
Yeah, that is it's another myth. First of all, what we talk when we talk about high blood pressure. So our blood is flowing in the artery and the heart is pumping, and to make the blood flow generates a certain pressure. You can imagine that as long as the bloodstream doesn't have a lot of resistance, is not narrowed down, the blood flows on a certain pressure. If the arteries are more narrow or so, the pressure that the heart has to generate is higher. But the generation of this higher pressure causes as a consequence is also that it can damage the arteries.
Okay.
So the higher is the blood pressure, the worse it is.
Got it.
Now, normal blood pressure is 120/80, but we have evidence that even if your blood pressure is 130/80 or 140/80, so just a little higher than normal, in long term, that can be detrimental. So those blood pressures, though, those like stage 1 hypertension, meaning like those levels of blood pressure a little above the normal, those are pressures that they will not cause any symptoms. Okay. They're very, very tolerant by your body. However, in long term, they will cause effect.
Okay.
So that's why it's called the silent killer, because on those levels, you won't have any symptoms, but it's going to have an effect 10, 15, 20 years from now. The symptoms that people think about when they have high blood pressure, like headache or visual disturbances, or even stroke or TIA, those type of problems, they usually develop with pressure that are much higher, 180, 190, 200. Those are things that require immediate attention and immediate treatment. I mean, it's a broad spectrum. When we talk about blood pressure, there is a very, very high blood pressure. There is also moderately high blood pressure, but still, it's a problem that needs to be addressed.
Absolutely. So important for people to get screens regularly to keep track of any small changes like that, because down the road, like you said, it could be detrimental. So important to stay on top of. Okay, absolutely. So another myth is I'll know when I'm having a heart attack because I'll have chest pain. So while it is common to have chest pain or discomfort, what are some of the other symptoms that people could look out for?
The vast majority of time, heart attack develops with a typical chest pain. And the typical chest pain, the way we define a typical chest pain is retrosternal or on the left side, and then with certain radiation to the left arm, radiation to the jaw, and sometimes to the back. But the pain can be also epigastric, right at the center, like the stomach, where you pointed to the stomach, especially when the right coronary artery, which goes right at the base of the heart, facing downwards, that's when usually the pain comes. But there are cases that we see commonly in which people don't develop the typical pain. And so what do we have to look for? Definitely anything that resemble pain. What it means, for instance, if you have sudden onset of shortness of breath, like if you at one point you're doing nothing and you just can't breathe. You feel that you don't get enough oxygen. It can be a number of things. It can be asthma. It can be other issues. But if something that is sudden and something that is remarkable will require immediate attention, and so a screening in the emergency room or energy center on it is something that you have to consider.
To get checked, of course.
Yeah.
And we have time for one last question today. So I think another common myth is that people, they think their heart is beating really fast. They must be having a heart attack. What could that change in somebody's heart rate mean?
Yeah, so that's a little bit of a different story. So again, this whole discussion we had was about this blockages in the arteries or so. Yeah. But the heart is a muscle and works with an electrical system that controls the heart. So if it is true so this electrical system can have little glitches, little problems. Mm-hmm. And those, they might not have absolutely anything to do with a heart attack. Those are called arrhythmias. That means that the heart can start to go very fast or very slow, not because something is telling the heart to do it. For instance, if you're running, your heart goes fast, that's normal. But if you're not running and you're sitting on your couch and suddenly your heart goes at a very fast rate, that's not normal. That is that an electrical glitch happened in the heart that makes your heart to go really fast. Is that a heart attack? No, that's not a heart attack. Can a heart attack, meaning can a blockage in the artery, cause arrhythmias? That's true. So whenever you develop symptoms of very fast heartbeat that last for a long time and that doesn't go away, let's say 20 minutes, half an hour, so I would seek immediate attention. But at the same time, the vast majority of the time, those arrhythmias that are addressed in a different way, most of the time they're not life-threatening, but they can be dealt with a small intervention, but they need appropriate detection and appropriate diagnosis. So it's something that requires attention, but it's generally not a heart attack.
Okay, makes sense. I'd like to thank you for joining today and debunking some of these cardiology myths. We know Dr. Rotatori is our marathon runner extraordinaire.
Yes,
so
sure.
we get all of our running advice and cardiovascular tips from Dr. Rotatori. And I'd like to thank you once again for keeping
Maybe
us
we can do another
safe
session.
And healthy. Absolutely. Love to have you back. If people would like to get some more information or come in for a consultation, they can do so by calling 718-818-7425 or by visiting rumcsi.org. That about does it for this episode of RUMC Connections. I'm Meredith Gaskins.
Thank you, Meredith. Thank you.